damn things I've never... Oh, hello. I'm not Dr. Jan. I'm here to talk to you about biomedical interventions for HIV, not a doctor. I'm going to tell you about things that you can do to make sure that you stay safe and HIV negative, or if you are someone living with HIV, how you can make sure that HIV doesn't get passed on to someone else. HIV impacts many different populations throughout the United States, but in Ohio, 53% of white females were diagnosed from injection drug use, and 92% of black females were from sex with other men. There's lots of other ways to protect yourself. Do you know what some of those ways are? Well, of course, there are condoms, but there's also regular testing, which you can get with Shay and TK at OHIV from their at-home testing. You can also schedule an appointment with one of the many testing providers throughout the state of Ohio. There's also a once-daily pill known as PrEP. Think about it like birth control, but for HIV. It's one pill once a day, and it's 99% effective. That's far more effective than other methods of prevention, and very, very safe. If you feel that you've been exposed to HIV, you can take a medication known as PEP, or post-exposure prophylaxis. Post-exposure prophylaxis allows you to take the medication within 72 hours of that potential exposure. You'll have to take the medication for 30 days and follow up with your physician on a regular basis, but it can prevent that transmission from actually turning into HIV. Then you can follow up with your doctor and make sure that your testing stays HIV negative. Then I would suggest, as not a doctor, that you explore options for PrEP. There are numerous ways to access it, and most people in the state of Ohio can access the medication now for free with a program known as PEP, or Prevention Access Program Interventions, through the state of Ohio's health department. Another method of prevention for folks who might be HIV positive is to regularly take your medications. When you regularly take your antiretroviral therapies, or ART, it can help you become undetectable. When someone is undetectable, they are untransmittable. This is often referred to as U equals U. If someone is able to take their medications on a regular basis and remains undetectable, they cannot transmit to partners. Therefore, it is an excellent way to make sure that you're protecting yourself and others from risk of transmission. Thank you. This has been a moment with not Dr. Jan.
Not Dr. Jan is not a medical doctor. The medical and nutritional information on this site is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay its seeking because of something you may have read on this site.